Hi, I'm Wing Commander Hariharan. I was in the Indian Air Force. I served for over 20 years and retired about 20 years back. Now, I want to tell you an interesting story about my own life. What happened was about a year back while I was driving, I found a little problem with my left eye and the vision was not good. So I thought maybe some dust has gone in on some kind of a minor issue with the eye. So I went to Dr. Zamindar's to have my eye checked up, and because somebody recommended me, one of my friends from the Air Force, he recommended me, why don't you try Zamindar? They got a pretty good name. So I went over there and I was right from the day one, did all tests on my left eye, and they they could easily make out that it was cataract advanced stage. And surprisingly for me, there was a cataract on my right eye also. So it's better to operate it as soon as possible, especially the left eye. The right eye you can take a little longer. You want to do it immediately, do it. You want to take a month, a few months. These days you don't have to wait for a cataract to develop. You see a cataract, get it operated. I mean, as soon as possible. The sooner you do, the better it is. Because if it hardens up, it's that much more difficult for the doctors to operate it. So after the tests were done, it was confirmed that I have a cataract. Then there was a counselor and she explained to me what are the types of lenses available in the market, how much it costs, what are the benefits of the lens, what are the problems in the particular lens, etc., etc. She explained, and also that certain lenses don't suit certain people. Well, like if you're a diabetic maybe, or you have some other associated problems, some lenses may suit you, may not suit you. I'm going for trifocal. It's a little expensive, yes, but then I said, Mel, what is an expense when I don't need a glass for reading, I don't need a glass for watching a movie, and I don't need a glass for driving, or I was short sight. So I don't need a glasses for looking long distance. So I said I'll go for that. Every test was done precisely, and it was absolutely a scientific environment was there in the hospital. Cleanliness was superb. It was absolute professionalism right from the step one when somebody was explaining to me the process. And they gave me some drop to put the day prior to the operation. I put on the drops, and after that I was guided into the operation room, and well, I was not really afraid because somehow looking at the way they were proceeding, I was very, very confident about the professionalism of the place I had been. So I knew that I was in good hands, and that matters a lot. They operated and they gave me again a few drops. Let me tell you one thing. Today, after the operation, I have absolutely something better than 6 by 6 is 6 by 5, I think. I have that kind of a vision. I don't need glasses for reading. I don't need glasses for watching movie. I don't need glasses for driving. I don't need glasses for night vision. I don't need glasses at all. I mean, personally, for me, it is nothing short of a miracle.